Thank you. And Tamando, I just thought that it was an incredibly nuanced and thoughtful explanation. And thank you very much for that. I'm going to step into the gap that Tamandra stepped around, as it were, and talk about the public health bit of it. Because I think one thing that's worth adding to Tamandra's explanation is that there are out there predators, fraudsters, and autocrats who are grabbing this technology, this incredibly powerful technology, and turning it for bad use. And we shouldn't be naive in failing to recognize that threat. And what we have to balance in our own minds is these three very difficult, conflicting requirements. Firstly, is a knowledge that there is such a thing as a moral panic. We can get confused and distracted. 2018, there was a concern about Dungeons and Dragons. 2008. Dungeons and Dragons, that rather spotty, nerdy, fun game that I used to play when I was a teenager, somehow was leading to a spike in suicides. Now, this was based on a one-off story and was simply not true on any level at all. But it was followed and supported and chased down, and Dungeons and Dragons was demonized for it. So moral panic can exist. I think, though, that the concerns about the connection between mental health, particularly amongst children, and the use of technology today is of a different order. And the reason why I think that is that the technologies that are being directed at the minds, particularly of children, is of an incredibly sophisticated order. The use of psychological insight, the use of algorithmic ordering in order to put content in front of people that will fill the gap, as Tamandra very well put it, is so effective. In the UK, last week, there'll be 1 million kids who spent more time on their telephones than they did at school itself. And the psychological impact of it really is very profound. And the evidence, unlike with moral panic issues where there isn't any evidence that there is a problem, even if people are very worried about it, here the evidence really is profound, both in terms of the psychological harms, but very importantly on educational attainment, where it has fallen off cliffs in those areas where there isn't restriction on children having access to mobile phones. And the money being made out of these children is of the order of tens or hundreds of billions of pounds. And the prevalence across Western society is huge. So for those 5 reasons, I do think that there is a difference between the current concerns about youth mental health and mobile phones and the moral panic concern is quite different. Now, why do I think that we should be doing this? Partly, it's in order to guarantee the future, because we're on the brink of another amazing technological revolution, this one using AI, big data, the metaverse, crypto, and all the sort of second order improvements in digital technology, which we're seeing come through at the moment. Now, every time there's one of these revolutions, I begin it being incredibly optimistic, and then I begin to grow more worried that these new tools will be used by the predators, the fraudsters, and the autocrats for adverse uses. And that is what I'm concerned about now. We need to get the guardrails in place today so that we can benefit from the really good things that have come out of the AI revolution. And if we don't, we're going to trip up and there's going to be a backlash, as there can be against technologies that have somehow failed society. So that's why, with all due consideration for free speech and for freedom of choice, I am hard over on the public health arguments around particularly social media, but also the other parts of smartphone use by children. That's why I push really hard to get smartphones out of schools. And that's why I would go so far as to say that children under 16 really shouldn't have a smartphone at all. And in that, I've got increasing support from people like the US Surgeon General and other serious clinical characters.
Okay, thank you very much.